Hi guys, welcome to the EMPWR Podcast. Today I have a very exciting guest, Dr. Mae Hughes. She is a pelvic floor physical therapist and giving us all of the insight and knowledge on pelvic floor. So whether you don't have kids, plan to have kids, maybe already have kids in postpartum journey, she's going to give us insight and knowledge on why the pelvic floor is important and how we can go about doing things in our daily routine to help strengthen that. So Dr. Mae Hughes, thank you so much for coming on.
Thank you so much for having me. I could talk about the pelvic floor for days, so I'm excited to do this podcast with you.
Same. Okay, so first, give us a little intro on what's going on. So you have an app, you have an amazing Instagram that's so insightful. Give us the rundown.
Yes. So first of all, I'm a mom of two, recent mom of two. So I have a 3-month-old at home, and then 2.5-year-old. So they have changed my world. But in terms of pelvic floor physical therapy, yes, I have a pregnancy program and a postpartum program, and then just kind of daily pelvic floor fitness workouts, because you don't need to be pregnant or postpartum to have pelvic floor issues. So that's kind of really what I specialize in. I still treat patients. I'm on maternity leave now, but I treat patients in the Nashville area, and I could go on and on about all things pelvic floor.
Yes. Okay, so you treat both in person and virtual then when it comes to patients?
Yes, I prefer in person. I've only taken on a couple of virtual because I just, with my programs being virtual, I love to still talk with people one-on-one in person. So any chance that I can, I'm still going to want that in-person interaction. But then I work with a ton of women online.
I love that. And with your app, I'm sure that's helpful to touch the virtual side of things.
Exactly.
Well, I've just loved following you, and I feel like you just put out such great educational information around pelvic floor because before learning more about the pelvic floor, I truly thought it was only like a pregnancy, postpartum thing to think about and do exercises for, but you don't have to have kids to have a strong pelvic floor, and it benefits you in so many different ways. So for somebody that's like, I have no idea what the pelvic floor is, can you give us a rundown of what the pelvic floor is and consists of?
Yes, of course. Pelvic floor 101. So think of a soda can in your brain. So your soda can is kind of like your internal core system. The top of the soda can is your diaphragm. The bottom is your pelvic floor. The front of the soda can is your classic abdominals, like your 6-8-pack abs that you think about. Okay. The obliques, your oblique muscles are the sides of the soda can, and then your lower back is the back. So the pelvic floor is really part of a larger inner core system, and it works together with all of those muscles. So if you have any issues at any part of that inner core system, say, a weak, abdominal muscles that are in the front, that can impact your pelvic floor because you have to maintain that internal pressure system. If you think of a soda can, if you make a hole in the front of it, that's going to cause issues with the pressure management of the system. So really, it's part of that bigger inner core system, and it helps to also support your pelvic floor or your pelvic organs. Think of your uterus and your bladder, your bowels. It has a role with bladder and bowel function, intercourse, even stability of your lower back and hips and the surrounding musculature. So it does it all.
So much. I was about to say, I feel like it's like the center of so many different things. And so why is it important to know that pelvic floor doesn't matter if you have kids or not? Like how does it make a difference in your everyday life without kids or being pregnant?
Exactly. And like you touched on, a lot of people think you have to be pregnant or have had children to really even consider or think about your pelvic floor. But really everyone has a pelvic floor. Even males have pelvic floors. And if you have weakness or have overdeveloped your pelvic floor. So you can have too tight of a pelvic floor, you can have too weak of a pelvic floor, one that's working too much. That can interfere with that inner core system that we were talking about. And so if you have, say for instance, weakness, you've never had children before, but because the pelvic floor interacts with your pelvic organs and bladder and bowel function, you can still have leakage. If you have a weak pelvic floor and it's not closing down.
And when you say leakage, like peeing, right?
I mean, you can have urinary incontinence, but you can also have fecal incontinence.
Oh my goodness.
Yes.
Wow.
That is not as common if you haven't had a vaginal childbirth, but it is still something that I will see. So if you have, if you have pelvic organs, which everyone does, then your pelvic floor can be impacted with day-to-day function.
So interesting. And I feel like the pelvic floor, like I truly, before I became educated, thought it was just like the muscles of your core, right?
Yeah.
Like I didn't realize it's there's so much to it. Like, can you explain with the soda can, which is so helpful? So it's like you can have a 6-pack or an 8-pack and be ripped looking, but still have a weak pelvic floor, right?
Totally. Yeah. You can, if you have a 6-pack ab and you have really developed, abdominal muscles, that's not necessarily your core. So the way that I will refer to the core is always going to be that like system versus your actual, abdominals. I'll always just kind of say abdominals. But if you have really strong abdominal muscles, but they don't give way in terms of they don't have mobility when you're breathing, then that can create too much pressure downward into your pelvic floor.
Interesting.
Because you always want that inner core system, that soda can, to have even tension distributed. So if you have really tight muscles in the front, but like really weak muscles down below in your pelvic floor, you can still have that pelvic floor issue in whichever way it manifests, whether it's, leakage, pelvic pain, painful intercourse, what have you.
So many different symptoms. So I'm sure there's people listening right now that are like, what do I have? Like, do I have a strong pelvic floor? Do I need some work? Is it too tight? So walk us through like some of the symptoms that we can be aware of when it comes to a weak pelvic floor, but then also a tight, because I didn't even know there was like such thing as a tight pelvic floor.
Yes. I'll actually start with a tight pelvic floor because a lot of people, I think it's becoming maybe more mainstream, or maybe because I'm a pelvic floor physical therapist, when I go on social media, that's all I see is pelvic floor content. But I think it's becoming more mainstream. People are starting to realize it's not just about the strength of your pelvic floor. So signs of a really tight pelvic floor can be painful intercourse. Is probably one of the biggest ones that I will see both in person with my patients, but then just in my community online. Because, imagine your pelvic floor muscles wrap around your vaginal opening. And so if those muscles are really tight, they're going to make that vaginal opening smaller. And so it's going to be more difficult for the pelvic floor muscles to stretch to allow for penetration. So painful intercourse, honestly, incontinence can go both ways, which I know is so frustrating. You just want it to be black or white.
Right.
But if you have too tight of a pelvic floor and it's kind of always on and clenching, then when you go to do a jump, like a box jump, your pelvic floor muscles need to be able to absorb force. But if they're really tight all day long, and then you apply force to them, sometimes they're just like, we give up, like we're exhausted, and then a little bit of leakage happens. So you can have leakage, you can have painful intercourse, pelvic pain in general. So not necessarily just with intercourse, but you could be sitting and have pelvic pain, which a lot of people can develop in a chronic sense. Low back pain, hip pain can all be signs of a pelvic floor that is too tight and it's not giving way.
Interesting. Okay. Yeah. I'm like trying to think right now. I'm like, am I experiencing any of those symptoms?
Yeah.
Because here's the thing too. I feel like with a tight pelvic floor, if you are lifting weights, and because I want to touch on like the strength training aspect, which can obviously help that, but like it could cause a tight pelvic floor as well, right?
Yes, especially because a lot of people think of just contracting the pelvic floor, that classic like Kegel squeezing up and in, but then never think of the relaxation part. So imagine if you're doing a bicep curl and you're just only doing the top half range of motion. You're never fully lengthening your arm during a bicep curl. Your bicep muscles are going to get overworked, exhausted. You're going to have that buildup of lactic acid. It's going to just be exhausting and fatiguing for your bicep muscle. So that's why you work it through a full range of motion. Same thing with your pelvic floor, is a group of muscles that needs to be able to go through a full range of motion in order to function optimally. But so many people think of that tightening, and especially with weightlifters, because you do have to brace a little bit more, that can tend to lead to a tighter pelvic floor if they're constantly gripping or squeezing their pelvic floor.
Interesting. Okay. I want to touch on the strength training in a little bit, because I'm sure people experience that. So let's go to the flip side with a weak pelvic floor. Walk us through like symptoms when it comes to that.
Yes. Some of them can overlap, but a common one would be prolapse. So prolapse is kind of when your pelvic organs start to descend into the walls of your vaginal opening. And so depending on the depth of those pelvic organs descending into the vaginal wall, you can grade the prolapse based on severity. So especially women who've had a vaginal birth, if they see some sort of like bulge or, just skin, something that doesn't quite look right when they're doing like a self-exam of their vaginal opening, that is a sign of potential prolapse. And usually, I don't want to say always, but a lot of times it's from a weaker pelvic floor, because the vaginal walls have become weak and they can't support the pelvic organ. So your pelvic floor is like a bowl and your organs sit on top of it. So if you get weakness, those organs are going to descend a little bit. Now, if we get into the nuances, it can be masked by a tight pelvic floor, but you know, we're starting 101 here.
But that's when it's great to see a pelvic floor physical therapist to kind of assess what's going on.
100%. And that's why trying to, you know, go based off of just one symptom sometimes is not enough. It's more of like a comprehensive approach. But other signs of weakness can be that, you know, urinary leakage again.
Right.
Or fecal incontinence too. So if you're not able to contract your pelvic floor muscles to squeeze around your rectum or your urethra, then you're going to have leakage of whatever comes out.
And speaking of leakage, kind of like on the same train. So somebody that maybe has to pee all the time, can that be a sign of a weaker pelvic floor?
It's usually a sign of an overactive pelvic floor. Oh, wow. So if your pelvic floor, the way your bladder works is as it fills with urine, it needs to relax in order to kind of expand a little bit. And your pelvic floor contracts to prevent your urethra from allowing the urine to flow. And so sometimes if it is too tight, it presses up against the walls of the bladder and it kind of stimulates to the bladder like, hey, I need to use the restroom. And that can be far more frequently than is normal. So normal, you know, amount of time before you use the restroom again, when you're talking about urine, would be about 2 to 3 hours. So if you're going, you know, once an hour or just every time you leave the door, every time you walk into a new building, that's usually a sign of an overactive bladder. And your pelvic floor should be able to maintain strength as your bladder fills and expands, but not give way. So imagine like a trampoline. So if you're like pressing down on the trampoline, it's still maintaining your body, but it's lowering and lowering, but it's not completely just breaking through.
Right.
And so, yeah, a lot of people with overactive pelvic floors don't have that good force absorption. And so it's kind of telling their bladder, hey, we need to go.
I think I dealt with that for years, like before kids, because obviously I am so much more active post kids than I was before. So I'm sure I've done a lot of work on my pelvic floor throughout that. But I used to go pee like all the time and then like in the middle of the night. But now it's like I feel like pretty fine. And like, you know,
that's great.
Scheduled appropriately, I guess.
Yeah. 5 to 8 times per day.
Exactly. But I do think it really, I know for a fact it's because I really prioritized my pelvic floor the past few years.
And you can also train your bladder too. So sometimes what I'll do with patients who are struggling with like the overactive bladder going all the time is create a bladder diary truly and note down how often they're going, looking for triggers. Like caffeine is a common one, spicy foods, creatine a lot of that can trigger the feeling.
Okay, we're gonna have to talk about the creatine. Spill the beans. What? Okay, what about creatine?
It can just be a trigger it can act like caffeine in sense of stimulating your bladder that it needs to use the restroom. And so that's a common one that I see with a lot of women who use creatine right before, you know, a workout. That can maybe be something that we look at. Okay, can we decrease it to half the amount, or can we increase the length of time between you take the creatine and when you actually work out, so that way you're not dealing with either the urgency or actually leaking during a workout.
Interesting. And just to kind of give, because I talk about creatine a lot on my platform, so to kind of give context, so creatine, it increases that ATP production, which is like the energy source for your muscles. So that really does make sense why that would start that. So,
stimulation of like blood flow, increased activity of the muscles. So that's a very common one. So just like bladder irritants in general, sugar can be one. That can increase the irritability of your bladder. So then you have this sense of needing to go to the bathroom more often than normal. And then you also, like I said, can train your brain, because part of it is your brain perceiving the idea that it needs to use the bladder, or that you need to empty your bladder is signaling to your brain. And if you kind of train it to go, you know, every time you leave the house or every time you get to a new building, your bladder is going to tell your brain, hey, we need to go, but it might not actually be completely full yet.
Right.
So yes, you can train your bladder.
Okay, so for anyone that's in this position, a bladder diary.
Bladder diary. Just start to take note of like, how often are you going, and are you eating certain foods or drinking right beforehand that's leading to that urgency. Like caffeine's a big one for me.
Right.
But I'm never going to give up my coffee.
You're like, that's non-negotiable. We're not doing that.
Non-negotiable. We're not giving up
going
coffee.
there, guys. No, I'm the same way. I love my caffeine. This episode of the EMPWR Podcast is brought to you by Blokes Enjoy Wellness, my go-to for all things health, blood work, and hormone support. Okay, let's talk hormones, because if you're constantly feeling off, there's a good chance they're playing a very overlooked role. And trust me, I've been there, just feeling exhausted no matter how much sleep I got, dealing with bloating that made no sense, and honestly just feeling like my body wasn't working with me. And that's why I love Blokes Enjoy Wellness. And one of my favorite phrases is test, don't guess. And they make it so simple to get real answers. Their hormone panel helps you understand what's going on beneath the surface, whether it's high cortisol, estrogen dominance, or just sluggish thyroid function. You're testing and you're not guessing. Plus, their science-backed supplements are formulated to actually make a difference with targeted support for PMS, stress, metabolism, and overall hormonal balance. And we put so much effort into our workouts and nutrition, but if your hormones are out of whack, it can feel like you're spinning your wheels. Blokes Enjoy gives you the tools to work with your body, not against it. So if you're tired of feeling off and want to start truly feeling your best, Blokes Enjoy Wellness makes it easy. Head to choosejoy.co and use code SAMCFITPOD for 50% off your first order. Feel better, live longer. It all starts here. Okay, so a big misconception is that pelvic floor therapy and kind of being aware of the pelvic floor is only for postpartum, pregnant women. We've talked about that. So for somebody that, maybe doesn't have kids or is planning to have kids down the road, but not yet, like what can they do to kind of, condition their pelvic floor to be in its strongest state?
Yes. I think one of the best things you can do at this point is just learn to lengthen it and learn to contract it. Like, can you have actual awareness of what your pelvic floor is doing as if it were your bicep muscle? Like, you obviously know when you are extending your arm and when you are flexing it, but do you have that awareness with your pelvic floor? Can you actually contract around your 3 holes of the pelvic floor? So the vaginal opening, the urethra, the anal sphincter, can you actually contract those like consciously? And then can you actively relax and lengthen them as well? Because that seems to be the biggest part of pelvic floor therapy, or is just building that awareness of, can I even contract around everything? Can I relax it? A lot of people, when they go to contract their pelvic floors, end up squeezing their butt cheeks a lot and tensing up and moving their hips. So trying to do that without you shouldn't be able to see a pelvic floor contraction. Right.
Well, as you're saying this, I'm trying to do it myself.
Can you do it?
I think so. Yeah. But that's like a Kegel, right? Talk to us about Kegels, because I feel like there's such hype, or there used to be. I feel like people maybe are not as into the whole Kegel thing now, but is that what we should be doing to help, get stronger pelvic floor?
Yeah. And Kegels, in the fitness industry, there's always these trends of do this is terrible. And then flip flops, whatever. Kegels aren't necessarily inherently bad. What makes them bad sometimes is when physical therapists or people, I don't know, your OBGYN, your midwife prescribe them when you don't need them. So if you have a really tight pelvic floor and then your PT says, go ahead and do 3 sets of 100 Kegels every day, you're just making it tighter and tighter and tighter.
Right. We don't want that.
Exactly. We don't want it. You're going to have more pain with intercourse, more urinary incontinence, what have you. And also they focus so much on the contraction of the pelvic floor and forget about the relaxation of it. And that's usually what so many of us have. We're clenching our glutes all day. We're high stress. We're squeezing everything. When you don't get full, deep breaths, diaphragmatic expansion, you're not getting full pelvic floor lengthening. The two go hand in hand. So if you find yourself, not taking full breaths all day, holding your breath, you're probably tensing your pelvic floor. And so
that's such a good way to look at it. Okay.
Yeah. So that's another thing you said. What can people do who maybe aren't pregnant or postpartum? Can you just take good 360 diaphragmatic breaths? And are you doing that throughout the day, or are you, holding your breath or breathing up in your chest muscles, that sort of thing?
Interesting.
But yeah, Kegels, like I said, they're not inherently terrible for you, but I think they're overly prescribed and they're seen as the be all end all. But really, if you think about the whole core system, there's so much more that goes into it. Looking at your abdominal muscles, your low back, your hips, all of that can play a role in your pelvic floor function. So
it's just one tool.
It's just, one tool. And most people don't need to do a ton of thousands of pelvic floor contractions all day long.
Right. Okay. That makes so much sense. So thank you for clearing that up and kind of giving us some insight on that. All right. So for somebody that, is obviously not postpartum, pregnant, doesn't have kids, are there some like good exercises they can do every single day just to kind of maintain a healthy pelvic floor?
One of the best ways is just by working on deep core stability. Okay. So thinking of your core, has multiple layers, especially abdominals. You have your rectus abdominis, which is your big 6-8 pack muscle in the front. And then you have layers below it, the deepest being the transverse abdominis. And that muscle has fascial connections to your pelvic floor because they both attach onto the pubic bone. And so by working on your deep core stability, both on contracting it and relaxing it, you inherently get that pelvic floor movement that you need of the contraction and the relaxation. So there's not necessarily one best exercise, but can you engage your deep core? And then can you also relax it through movement? Can you avoid holding your breath during a heavy squat or a heavy deadlift? I think a lot of people brace when they're going for a heavy squat or a deadlift, hold their breath, and then that can create more pressure downwards.
Interesting, which I feel like I'm definitely guilty of that sometimes. I use a lot of barbell, and so it's like you're doing a lot of bracing, and it's like you have to remember to breathe through that too, and really connect your mind with your pelvic floor. So
exactly, and unless you're, going for a world record for a deadlift, you don't necessarily need to be bracing, but always take a look at what are your goals. If you are a power lifter, right, then that's your sport and you need to be able to lift heavier and heavier, then maybe you do need to brace. But for most people, you can kind of breathe through those lifts.
Okay. So I would love to pick your brain. So what are your thoughts on heavy lifting?
I mean, I love weight training. Okay. Absolutely love it. I think that in terms of Olympic lift, that's kind of like how I see it, because weight training has a lot of different forms, right? If you're just using weight, anything can be considered weight training. So more of like your Olympic lifting, those really, really heavy lifts, I'm not against them. I just think that if you're experiencing pain with any of those movements, or you feel like you're forcing yourself to do those movements, then it's probably not the best for you. There's so many other ways to develop muscle. As long as you are getting your muscle and loading it close to failure within, 1 to 3 reps by the end of your set,
right,
you're growing your muscle. And so if you want to do that with free weights, great. If you want to do that with, a barbell, also fine. I think there's also different seasons for it. I was doing a lot more barbell lifting when I had time for hour-long workouts before 2 kids.
And it takes time, especially if you need to rest appropriately in between. And yes,
exactly. So that's not necessarily happening for me right now. I'm just doing what I can.
Just in a season. You're in survival mode. You're doing great.
With free weights at home. But I'm not necessarily against it. I'm just against forcing your body to do something that it's not working with your body. Now, there are times where, I don't want to say like a certain type of lifting, but a certain type of lifting can force you to lift heavier loads than your form allows, that your pelvic floor allows for, and that your breath allows for. So if you're having to hold your breath to get any weight overhead, it's probably not the best for you. Maybe you need to decrease your load, or if you're forced to do a certain amount of reps in a certain amount of time, then you might be losing that form and that breath work. So that's where I get a little frustrated sometimes with heavy lifting, is when there's these parameters that don't allow you to practice good form, good breath work, good bracing.
I'm completely on the same page, because on my platform, I talk a lot about like heavy lifting and, but also being aware of your form and your technique and your breath and listening to your body from like a holistic standpoint. Because to your point, like having some type of, pelvic floor, whether it's tight or weak, that can affect the way your back feels, your hips, different things, right? So it might not be the weights. It could be you're disrupting your pelvic floor, which is causing a lot of other symptoms.
Exactly. And your pelvic floor needs to be able to accept force and load just like any other muscle. But if it's too tight, then maybe more of that load's going to go to your lower back, or more of it's going to go to your core or your hips or something like that. So it can lead to a lot of overactivity in other muscles because they're compensating for some sort of pelvic floor dysfunction.
Right. Interesting. I'm so glad we touched on that. Okay. So for somebody that maybe is having some pelvic floor issues, but they also want to weight train or strength train or do some type of activity, like where do you think is a good starting place for that individual?
Usually if someone's experiencing pain or dysfunction, and people hate this, but taking, a couple weeks to deload, like stop the weight training. If you're really experiencing, severe incontinence or things like that are life altering, it is worth it to deload for 2 or 3 weeks, really focus on pelvic floor relaxation and contraction and coordinating it with movement. Can you control your breath? Can you make sure you're evenly distributing your breath into your lower back and your ribs and your pelvic floor before introducing load? So that's usually what I recommend is,
just taking a break.
Just taking a break, giving your body almost like a reset. Just like reset everything, reconnect with your body, reconnect with all the inner core muscles, and then slowly build load from there. But, a lot of people don't want to do that.
Yeah.
Or maybe their sport doesn't allow them, which
Right.
I totally understand. In that sense, it's usually best to work with someone one-on-one to kind of really tailor a program for you. But yeah, trying to just...
Well, I feel like a
reset.
deload week, I mean, I program that for my clients
Yeah.
too. Like that's good for anyone, no matter where they're at. But if they are experiencing, pelvic floor issues, just to have that time to like, okay, what's going on? Give my body some rest too, right?
Yeah.
Okay, so let's talk about postpartum pregnancy. I know a lot of my following have kids or pregnant or planning to have kids and get pregnant. So give us a rundown of the pelvic floor when it comes into relation with those things.
Yes, during pregnancy, your pelvic floor undergoes quite a bit of stress, right? As you are growing, as your baby's growing, your uterus is growing, everything's becoming heavier. There's just a lot more stress onto your pelvic floor. And so that's when people might start to notice symptoms that maybe they never had before, but they're all of a sudden developing them during pregnancy, just because there's a lot more load on your pelvic floor and it's getting stretched out through the, growing weight of your baby. So that's when things like, low back pain, pelvic floor pain, or SI joint pain can kind of start to creep in a little bit. But that being said, people kind of want to go straight to strengthening your pelvic floor, but it's the same thing that we talked about before. You need that length as well, because as your uterus is growing, baby's growing, your pelvic floor needs to be able to lengthen while maintaining force.
Right.
And actually, a lot of people can develop too tight of a pelvic floor because they're clenching it all day long because they feel this heaviness and weight on their pelvic floor that they'll clench it all day long and then actually kind of exacerbate some of their issues and develop too tight of a pelvic floor. And then, coming to labor and delivery, if you're having a vaginal birth, the pelvic floor stretches up to 3 times its resting length.
What?
3 times. Yeah.
3
during a vaginal birth.
That's crazy.
And I don't necessarily know how much it stretches during, pregnancy in general, because I think people think if you have a cesarean delivery, your pelvic floor is not affected.
Right.
But if you've been pregnant for 9-10 months, your pelvic floor is still 100% affected just from pregnancy. And I'd be curious to know, I don't know if there's a study on this, like how much it stretches just from being pregnant, from the additional weight on it. But especially if you, have a trial of labor before you have a cesarean delivery and you start pushing or going through labor, your pelvic floor still very much is affected with that stretching.
Oh, I'm
3
sure.
times.
And here's the thing too, like I obviously have 2 kids, been pregnant twice. I know what it's like to feel all those things happening. And it's, it could be that some people think, okay, this is normal with pregnancy to feel these things. But how do we know if it's just normal pregnancy twinges or pains or discomfort versus like, okay, here's some pelvic floor issues. I need to do something about it.
Yes. Honestly, anytime something starts to affect your daily life, if it's impacting your ability to stay active during pregnancy, work during pregnancy, lift your kids, if this, it's your 2nd or 3rd pregnancy, then it's time to get some help. Now, if it is, I've been pregnant twice as well. Well, I have had 3 pregnancies, 1 miscarriage. If you, take a step and you feel this little like twinge, but then it kind of goes away, that's not necessarily something to become worked up about. But if it's starting to really be constant and affect your daily life, like if you cannot get out of bed due to low back pain, or every time you get into your car, you feel that like pelvic pain, like that pubic symphysis pain, it's your pelvic floor and you need to get some help.
I had that.
Yeah.
With both of my pregnancies, the like shooting pain.
Yes.
Less with my second. And I think it was because I was more active when I was pregnant the second time around. But oh my goodness, those are not fun.
Yes.
What does that cause from?
So the most common one, if you're talking about pain kind of like in the front of your pubic bone.
Right, where it like kind of shoots up.
So there's like a couple things that can go on. You can have pubic symphysis pain. So you have the symphysis pubis joint in the front, which is where the two parts of your pubic bone come together. And normally that joint doesn't stretch very much, but during pregnancy, you have increased elasticity through all of your tissues. And so that joint, that cartilage connects it, and that cartilage can stretch up to like 9 millimeters, which doesn't seem like much, but for a joint that normally only moves like 4 millimeters, that's almost twice as much movement. So you need increased stability typically at the pubic symphysis joint, which is usually why if you are doing appropriate strength training, you might not notice as much of that pain. But that usually comes from the increased elasticity and just the changes of your pelvic positioning that occur during pregnancy. But sometimes you can also have like round ligament pain.
I think that was kind of my thing. I wore like the band and that helped, but still was there.
Yeah, definitely still there. The round ligament, you have two on either side of your uterus, and it connects from the outside of your uterus down and actually inserts into your labia. So that's why like that like lightning crotch, that's kind of what they call it.
Wild. Okay.
So it's just as your uterus starts to shift forward and your belly starts to grow out more forward, those ligaments become stretched. And so you take, you know, one weird funky step and you might overstretch it. Like when you're like, oh my God, that's exactly what can happen.
What are some other symptoms in pregnancy of pelvic floor dysfunction?
So pubic symphysis is probably a huge one that I will treat people for and that people complain of. I mean, low back pain is another common one because your center of gravity changes. It's a little more in front of your body, so your lower back's having to kind of support more weight. And with the postural changes, a lot of times people just tend to allow their belly to hang forward rather than thinking about standing up straight.
Right.
So it just puts more stress on your lower back. A lot of times people, especially in subsequent pregnancies, might develop incontinence, maybe because they didn't fully rehab from their previous pregnancies. Right. A lot of times with subsequent pregnancies, you'll see the earlier onset of pelvic floor dysfunction if you didn't properly rehab and continue strength training between pregnancies. So the common ones, you can have incontinence get worse, prolapse get worse, pretty much anything just gets a little more intense during pregnancy, especially if you already had it prior to.
So having a pregnancy where I didn't do any kind of pelvic floor therapy or exercises, and then my second I did, it's like night and day difference of the pregnancy, how I felt, but also the delivery and like the labor experience. So what would you recommend when somebody finds out like, hey, I'm pregnant? When should they start doing these exercises and really paying attention to their pelvic floor?
Honestly, like day one, even before you get pregnant, just building that awareness of contraction versus relaxation, the full breathing, because your posture just changes so much during pregnancy. Your ribs expand, 2 to 3 inches, and that changes the way your diaphragm can fully expand, which then impacts your pelvic floor, going back to that soda can, that internal pressure system. And it's easier to build that awareness when you're only in the first trimester and you're not working against this larger belly. It's really easy to be like, okay, I feel it contract, I feel it relax, I feel my diaphragm, ribs expand. It's a lot harder to start working on that when you're in the third trimester and you're like, I can't feel.
Right.
Like, what's going on?
This is past the point.
Yeah.
Are there any specific exercises or like workouts that you would recommend for, just to start with?
A lot of that same like deep core training, especially working on like rotational movements. A lot of times during pregnancy, you lose a lot of rotation, because sometimes people still believe that you shouldn't rotate at all during pregnancy. Yeah, it's like a weird common misconception that I get asked about all the time. Like, my provider told me like, don't do rotational movement. I was like, what? Like,
that's our bodies are built to do that.
Exactly. So including a lot of like rotational oblique strength training during pregnancy is really helpful, especially to help decrease the abdominal separation that occurs, which is occurs in like 100% of women by the time you get to the third trimester.
The diastasis. Okay.
Yeah. So the diastasis, if you're looking at like a textbook definition of it, it's more than like 2.5 centimeters of distance between the two halves of your rectus abdominis, that six-pack muscle. And it occurs there's studies that show it occurs in 100% of women by the time, they're like 36 weeks.
So that's very common and normal.
Yeah, if your belly didn't stretch, your belly would have, your baby wouldn't be able to grow. Like
Right.
there would be nowhere for anything
It's a positive
to
side
expand.
that the baby's growing. Right?
Exactly. But when it becomes excessive and maybe it expands more than it was needed because you don't have proper form or proper breathing mechanics, or maybe you stopped strength training your core during pregnancy, that's when you can have a larger separation than is needed. And then that becomes really hard to come back together postpartum. And that's when you have that diastasis that continues and you don't see that closure of the gap. And I don't want to say full closure because there can be slight variation in how much it comes back together. But
and question for you, when it comes to time frame with diastasis, am I saying that right? Diastasis?
Yeah.
With diastasis, is there a specific time frame that you should really be working on rebuilding that? Like, if you're a year postpartum, can you still heal that, or is it like too far gone at that point?
100% you can still work on your diastasis, honestly, at any point. People can develop diastasis even without being pregnant, but 100% you can work on it years down the road. Now, normally, if all things are going smooth and you're doing rehab earlier on in pregnancy, I sometimes start women with rehab, week 1 postpartum. Then within like 6 to 12 weeks, you should really see there be minimal, not only distance between the two halves, but also depth that you can insert your, fingers when you're testing for diastasis, how far down your fingers can go into your abdominal region. So it's about the depth and the width, but usually like 6 to 12 weeks, if you're doing all things appropriately, you should really see that come together and not be a huge factor.
Right. And so something that's interesting too is that, can that be caused from just doing improper ab exercises? Like, I feel like I've seen that. So like outside of pregnancy, postpartum, like you can develop diastasis from doing incorrect form.
If you are, a big sign of that, of incorrect form or incorrect intra-abdominal pressure management, is that coning.
Okay.
So coning is when you notice this bulging like appearance in the middle of your abdominal region. And that's usually a sign of improper pressure management, that too much is going forward out into your belly rather than being evenly distributed in that soda can. So ideally, you want the breath to go into your rib cage, the sides of the ribs, the lower back, down into the pelvic floor. It's evenly distributed. But if it only goes out into your belly, then that's when that increased separation can occur.
I see that a lot. So with some of my clients too, with like lying leg raises, you can really see that, where I always say, okay, imagine like pulling your belly button down into your spine. Like a lot of it's like mental, right? Like taking time, like you said earlier, with like form to breathe and like think about positioning of your body while you're doing these exercises.
Exactly. And taking the time to postpartum go slow.
Yes.
Really learn, because in the same fashion that your pelvic floor is stretched during pregnancy, your abdominals are very much stretched during pregnancy. And if you think of an overstretched hair tie, it doesn't just snap back to the way it was. It takes time for it to kind of go back together. So if you don't take the time to go through some of the easier core exercise, I know everyone really wants to get their core back after pregnancy and go straight to the harder exercises, but you got to think an overstretched muscle has a really hard time contracting. So you need to allow time, first of all, for your muscles to kind of
What does that look like? Like how long would you say?
For your muscles, I mean, if you're breastfeeding, you're going to have increased elasticity until kind of you're done breastfeeding. But that doesn't mean you can't still strengthen your core. But a lot of times once people stop breastfeeding, they notice an even next level of tightening of all of their muscles in their body. Like I said, if you're working diligently, usually like 12 weeks is a pretty good time frame. Usually 12 weeks to build muscle is pretty good time frame. But yeah, especially like with exercises like lying leg raises and things like that, if it's too high level for someone, or they just can't properly engage, then they're going to exacerbate the issue.
Right. And I think it's so hard too, because when you're pregnant, it does feel like forever. And then when the doctor's like, hold up on any exercises, and you're just like, I just want to get back to like the way I was, in a sense, like that can feel very overwhelming. But I tell people that too. It's like time is everything in so many different aspects. So you can come back even stronger.
Yeah. I mean, think about it. If you 12 weeks is a blip on the radar for the rest of your postpartum life. So if you can just take 12 weeks to go through gradual progressive rehab, you will be so thankful for it, because it's honestly harder to fix pelvic floor issues and diastasis further on down the road. It doesn't mean that it can't be fixed. It just usually takes more effort. then you got to take a full rest in the middle of your activity to kind of restart versus, early postpartum, if you just start on the right track
and build from that.
Yeah.
Okay, really quick. I want to talk about labor and delivery when it comes to like, do you see that to be the case, like night and day, like really working on your pelvic floor when it comes to labor and delivery?
Mm-hmm. Especially learning how to relax and lengthen it versus keeping your pelvic floor clenched all the time. Because that stretching, that 3 times the normal length needs to occur. And if you are someone who has just been told to Kegel, Kegel, Kegel all day long, then when you go to push, you don't need to Kegel. You need to relax your pelvic floor. Mm-hmm. And if the only thing you've ever learned is to contract, then you're actually going to prevent your baby from being able to descend fully. And that can potentially lead to, more issues that occur during labor and delivery and after as well.
And then like breath work accompanying that is very important as well.
Yes. Being able to link your breath work with your pelvic floor movement is really important for labor and delivery. And they just don't really teach that. Like in all these childbirth classes, they really don't. It is crazy. So with my first, I had like a hospital birth, epidural, all the things, did not work on my pelvic floor, was not active. My second, I had a home birth, no medication, did pelvic floor therapy every day, did the breath work, and it is crazy, like night and day. And you can feel that lengthening happen too, like with your pelvic floor and your uterus. Like it's amazing, like during the process. So, so I'm a big believer in like keeping that throughout your entire pregnancy. All right. So postpartum, I know there's probably a lot of women that feel, we talked about earlier, just that sense of urgency to get their bodies back. So what would you say their first step should be? If you feel comfortable, and granted, this is going to be up to everyone, I personally love working with women within the first 1 to 2 weeks postpartum, because there are so many things that you can do just to work on general mobility, especially if you went through labor, a long labor. Your body's exhausted, physically exhausted. So if you can work on your mobility of like your upper back and your hips and your abdominal region and that breath work within those first couple of weeks, you'll be off to such a better start than when you get your clearance at 6 weeks.
Right. So you don't have to wait until 6 weeks to start doing those little things.
Yeah. And I always am like nervous about saying that, because everyone should listen to their, provider. But in the same instance, OBGYNs, midwives, they're not trained in the musculoskeletal system of like rehab. So they're looking at it from a pure perspective of, have your stitches healed? If your
surgical.
Like a surgical standpoint, has the wound from your placenta and your uterus healed, that sort of thing, versus can you just do gentle mobility? I mean, if you have another kid at home, you're already lifting.
Right.
Your other kid, or even if your baby,
so true,
about 8 pounds, like they can be big.
They're heavy.
Yeah. And it's a physical task. So why not work on learning proper breath work when you are bending down and picking up your baby from doing a diaper change or things like that? So that's the kind of stuff that I will work on early within those first 6 weeks. And then usually by about, anywhere from 4 to 6 weeks, depending on how your labor and delivery went, really starting to incorporate more full body movement. And then really introducing weight in a slow, gradual manner from 6 weeks on.
Okay, that's great advice. Thank you for that. Okay, one last question when it comes to the postpartum, because I feel like there's so many women that experience this, is, hey, I've had kids, I just have this bloat, like my stomach just pooches out. Is that related to the pelvic floor?
100%. Now, there's a couple of factors that go into it. During postpartum, it's a stressful time period. So if you have high chronic cortisol, that can lead to an accumulation of belly fat in that region.
Right.
But then also, if you have not worked on your lower abdominal region, a lot of what's really common is for people to work on kind of their upper abs. So you get a lot of upper ab gripping from doing things like sit-ups, which aren't necessarily bad, but if you don't engage from the bottom up, from your pelvic floor to the lower core, then finally to the top region of your core, if you don't engage in that proper manner, you might get a lot of top-down pressure, and that puts more pressure downwards. And if it goes into your weakened state, which is usually your abdominals, because they've been overstretched, so they give way a lot easier. So pressure goes down and then it goes out, then it can kind of create this feedback loop of you're just constantly putting more pressure against a weakened state. And so then you're not getting that good contraction of the lower abdominals. It's very, very common, especially because not a lot of people have learned to engage their pelvic floor and the lower deep abdominal region.
Right.
So you get a lot of top down.
And to your point with the analogy of the soda can, and it's like, depending on where you're focusing in that distribution, that pressure is going to come in the other area that's maybe not as, strong.
Exactly.
So that makes complete sense.
Your body will always find the easiest path, the path of least resistance. And usually the abdominal region has been stretched and weakened. And so path of least resistance,
right,
air goes out that way. And now you're dealing with something that's a lot harder to manage and work on later on.
It makes complete sense. Okay, so I want to focus on you for a little bit because you're obviously a mom of two. They're the absolute cutest, by the way. Congratulations on your second.
Yes.
So you have a daughter, 2.5, and then a son who's just a few months old, right?
Yeah. Oh my gosh. It's only like my third time leaving him out of the house right now.
You're doing so good. I would never guess, but I know that's hard. I've obviously been there, and that's always hard. I'm sure he's in great hands. But for you, you're 3 months postpartum. That's not long. So how's everything going? And like, what are you doing every day to really help with you and strengthening your pelvic floor?
Yeah, I do strength training 4 times a week and then try to walk every single day. Honestly, for like a de-stressor, because motherhood, especially early postpartum, it's so stressful on the body. Yes. And I noticed those physical changes on myself that, decreased digestion, like things like constipation, super duper common.
Yes. Are you doing anything for that? Like magnesium or?
Yes, I take magnesium, and which is combined like in my electrolyte pack. So it's
that's
got
great.
Yeah, it's got magnesium, it has potassium, sodium, because you get so depleted of all those nutrients.
The water retention can cause a lot of issues too, and all that.
Sure can. So yeah, 4 times a week, I really strength train. Earlier on, the first 6 weeks, I was doing something almost every day, like 5-10 minute daily rehab. But once I got to 6 weeks, I kind of transitioned more to that strength training. Okay. That's what I lay out in my postpartum program, to really make sure you're not going from easy rehab exercises to then, a CrossFit workout class. Right. There's got to be some sort of bridge.
In between. And I think that's what so many women are nervous about, because it is kind of overwhelming in the sense of, okay, they weren't doing the workouts they were doing, right? They had a baby, their body's in a completely different state. So where do you start? Like, where do you jump in? And to your point, it starts with just a few minutes every day and then gradually building up. So it sounds like your app would be a great place for a lot of women to start.
Yeah. That's exactly why I first started just the first 6 weeks, because there's not a lot of information out there of like, what can you do the first 6 weeks postpartum? Like, you're clearly moving. A lot of women get the itch to do exercise, but then they're not told or, given advice on what they can do and how to properly do it. So then they overdo it, and you kind of just have this like runaway train. You're like, I don't know what I'm doing.
Right. And it's very overwhelming. I really enjoyed walking though, to your point too, for like the de-stressor, but it just like feels so good just to move your body, and, getting those steps in every day is obviously beneficial to your overall health as well. So
getting outside.
Yes.
Oh my gosh. Sometimes you can feel like a prisoner in your own home.
Got to get that vitamin D too. And then honestly, depending too, like for my winter mamas and fall mamas that sunlight's not out all the time, like that can be hard. So anything that, if there are those sunny days, it's nice to be able to take advantage of that. Okay. So your strength training, do you use a lot of dumbbells?
Yes. Yep. I do pretty much all dumbbell work right now. It's just my period of life that I'm in. Like I said, I was doing more heavy like barbell work before I got pregnant with my first, but just time consuming and things.
But you can do the dumbbell work at home, which makes it easier, especially when you have 2.
Yes.
Because going from 1 to 2 is a game changer. Or it's a game changer in the sense that your time is just completely gone.
Yeah. You never get a break anymore.
The breaks and the naps that you could take while the other one was napping, it's like, okay, you don't have that anymore. So that's awesome.
As long as you can, like I said, get to failure just with regular dumbbells at home. So that's where I'm at right now. And I actually really enjoy it. It's super easy to stay consistent when I don't feel like I have to do a lot of setup right now. I can just kind of plug and play and go for it, rather than focusing on, more form work with Olympic lifting.
Exactly. And then you get your walks in and you're probably feeling great. So I love that. Okay. So are you up for a little game?
Yeah.
I like to do a fun little game with all my guests. All right. So this one I have for you is called This or That.
Okay.
And it's pelvic floor edition. So this or that, pick one, but then also if you want to kind of like share your thoughts on it, totally feel free to. All right. So Kegels or Pilates?
Pilates.
Okay. Why?
I think Pilates takes a more rounded, holistic approach to deep core training. And I think you can get like the low back, you can get the obliques, the transverse abdominis, versus Kegels is just like one isolated
contraction,
move all the time.
Okay,
Not too much
good.
of anything though is never good for you. So like doing Pilates every single day.
Right. No,
can
that's
also
good
lead
to know.
you know,
Like too tight of a pelvic floor. To your point earlier.
If you do something every day, you need recovery.
No, that's great. All right. Yoga or strength training?
Strength training. That's
Okay.
Yeah.
I would have to say I agree with that too. I do love yoga. I can't sit still for too long, so sometimes it's hard. But
I love yoga too. Just
there's a place for it. But strength training, if I had to choose too.
Mm-hmm.
All right. Sitting or standing during work? And let's change it up a little bit. So like while pregnant.
Ooh. Honestly, this one's tough. Maybe.
And you can pick both.
What my answer would be is stay moving. So like don't stay in one position for too long.
Okay.
Because people are like, oh, I've been sitting, so I should stand all day. But then that can also be tiring, and you can fall into that like sway back posture where you're sticking your belly out and kind of arching your back.
Yes.
So I usually tell people sit on a ball, and every 10 minutes within an hour, get up and do a standing break and then sit back down. I think too much of anything can lead to issues.
Right.
But
no, that makes complete sense.
yeah, so I don't know if I could
That's a
choose
hard
one
one,
other.
I'm sure. Yeah.
Movement.
Both. Yeah. Just move. All right. Walking or running?
I personally have been in my walking phase of life. And I think that's because I just don't have the time. Running requires a lot of focus, training, and working on your form. And you can't just do running. You really need to be doing strength training as well, because you have to be strong to run and run correctly. And I personally don't have the time for that right now. And so walking can be equally as good for your cardiovascular system. So I'm gonna choose walking.
And I really noticed that too when I went back to running after my second. I like felt my pelvic floor like in the beginning it would just like bounce with each like step I took, and I was like, okay, running takes a strong core. I've realized this now that it's not where it should be. You know what I mean? So I totally agree with you on that. Okay, so breath work before bed or morning meditation?
I think before bed, because I've accumulate stress throughout the day, and most people do.
Yes.
So then taking the time to like wind down at the end of the day when you're most stressed out can help and release that tension. Usually most of us kind of wake up feeling well rested and maybe don't need as much.
Totally agree with that.
Relaxation.
But also too, if you're like doing your breath work, you might like sleep better too, which will give you better performance the next day. So
100%.
yeah, I totally am on the same page. All right. Home or gym workout sessions?
Oh, I really do love a gym workout session. I love like being around people. I love the environment of it. But yeah, so like in an ideal world, if I could bring my babies everywhere
and they would life.
If they would be occupied, I would love gym. I just like love being around people.
Yes.
But season of life, home workouts right now.
Hey, but effective as well.
Exactly.
All right. Solo workouts or group classes?
Solo workouts in terms of like effectiveness.
Yeah.
Sometimes group classes, if they're not working like properly programming different muscle groups every day, you might overwork the same like booty and abs every single day, and then that can lead to pelvic floor issues if you never give proper recovery. But I do love the environment of a group fitness class. I used to be a Barry's boot camp junkie. I mean, I still do.
Did you?
It.
Okay,
Yeah.
I love it. I know there's something about like other people in the same setting, and I feel like even if you do your own solo workout in a gym around other people, it like still is like, all right, motivates you. Where a group class is obviously very motivating, but
Yes. Yeah. No, I think a properly programmed group fitness class where you can actually get to failure, you get breaks for muscle recovery wouldn't be my ideal, because I just love people. But
right.
you know,
I'm on the same page. I agree with you. All right. Glute bridges or squats?
probably squats.
Okay.
Because you get good pelvic floor lengthening on the descent. Glute bridges, a lot of times people like squeeze their glutes at the top and get that additional like butt cheek squeeze when you don't actually need that. That can lead to a tight pelvic floor, especially posteriorly, if you over clench your glutes all the time. So probably squat, because you get like a full range of motion.
Yeah, that's great. No, I love the squats, like goblet squats, obviously like squats with a barbell, but even too like with the clenching of the butt cheeks and that throwing off pelvic floor, like with deadlifts and like other barbell stuff, I'm sure that could come into play. So just be mindful of is probably good.
Exactly. Yeah. Just be mindful of are you doing too much? Like, are you really squeezing? You probably can let that go a little bit.
Right. Okay, cool. And last one for you, because I saw this on your Instagram. Dates or no dates during pregnancy?
Dates.
Okay, tell us about a couple of benefits. Yes. I love eating dates all day, every day, pregnant or not, but like it's pretty beneficial.
Yeah, it helps to starting around like 36 weeks, I believe. I want to say it's 36 weeks, at least like 20 days before you go into labor. Trying to eat like 6 large dates or 6 smaller dates or 3 large dates, medjool dates a day can help to ripen the cervix. So it doesn't necessarily like induce labor. I think that's kind of the misconception. People think, oh, if I eat dates, I'm going to go into labor, but it helps to ripen your cervix, which helps with effacement, which is like when your cervix kind of stretches out and dilates a little bit. It's hard for a cervix to dilate against like a really stiff cervix. So you want your cervix to be like nice and squishy, like kind of like the tip of your nose.
Yes, I remember them telling me that. I was like, all right. I feel like my nose is kind of hard, but
a squishy nose.
Right.
That's like ideally what you want it to feel like. And so dates can really help with that, which can help to shorten labor in the earlier stages. So
and I can think of like worse things to eat. Like,
I started loving dates. I never stopped eating the dates after I got pregnant. I just love them. And now you do want to be careful if you have gestational diabetes or you're susceptible to something like that. Be mindful of your sugar intake. And like there are ways to spread it out throughout the day. And if you eat it, with protein, that can help kind of with some of that blood sugar spike.
Right.
But that's something to be mindful of. But I mean, the research is pretty strong.
That's amazing. I know that's honestly when I started eating dates. And have you seen like the date trend of what you put in it?
No.
And this is something I've been doing. So I feel like I should call dibs on this, but I've been doing this for years. But it's like going viral on Instagram and TikTok. But it's like the chocolate chip cookie date. So you take like a date and then you put grass-fed butter and then some chocolate chips in there. Ooh. And it tastes like a chocolate chip cookie.
That sounds amazing.
And it really does. It's so good.
Yeah, that sounds delicious.
You have to try it.
Yeah, I might have to. My favorite was what I would always do for baby showers. My like go-to dish to bring is baked dates with like goat cheese and bacon wrapped around them.
My boyfriend has been asking me to make those. I'm not even joking, for months now.
They're so good.
And I have not yet. So I think this is a sign from the universe that I need to probably make that this week for him, because
they're so good.
It's so good.
It's like the sweet with like the salty.
Yes. And I love goat cheese on anything. I'm just like, sign me up. Let's go. Any recipe with that. Okay. So something I love to ask my guests when they're on is around empowerment. So obviously that's the name of my podcast, my brand, Empower. But empowerment means something different to everyone. So I would love to hear from you. What does empowerment mean to you?
I believe that it means having the knowledge, but also the tools to act on that knowledge with everyday life and decisions. So feeling like you have the knowledge to be confident in decisions you make throughout your day, whether that's related to pregnancy or postpartum or just like nutrition or where you send your kids to school. I don't know, anything in life, just having the confidence through knowledge to make decisions.
I love that.
Me. Yeah.
And I feel like too, like to your point, it's having that knowledge to make those decisions that does change the course of direction in your life to maybe bigger and better things. So
exactly. Yeah.
I love that. That's great. Well, okay. Well, tell everyone where we can find you and hear more about your app and all the things you have going on.
Yeah. So all my social media is Dr. Mae Hughes, Dr. Mae Hughes. Website, Dr. Mae Hughes. That's where you can find everything. So I have a really extensive blog that answers so many of these topics or questions that we went over today. So if you're like, oh, I wanted to learn more about diastasis, like my blog has like very in-depth articles that I've written on all of these topics because people just don't talk enough about it. But then from there, you can learn more about my app where I have the pregnancy and postpartum courses, just the daily pelvic floor fitness, just in order to make pelvic floor just more, acceptable and also accessible for women. Yes. So those are the 2 places I'm most active. My website, social media.
Awesome. Well, thank you so much for coming on. I'm excited. I don't know if kids are in my future. I still haven't figured that out. More kids. But if so, I'm going to be signing up for your pregnancy and postpartum programs.
Love to have you.
I love it. Well, thank you so much for joining.
Thank you for allowing me to talk more about the pelvic floor.